Okay, well, first off, thank you all so much for driving in and braving the weather. It's kind of inspiring. So I'm going to talk about what your doctor really wants to know or how to make the most of your visit. So this is really aimed at folks who already have a diagnosis of Parkinson's disease and are going to kind of just a regular follow-up visit with your doctor. So just some practical tips that may or may not be obvious to everybody. So, what does your doctor want to know about or hear about? Your medications. We'd also like to hear about your symptoms and potentially any side effects you're experiencing related to those medications. We want to know about falls and difficulty swallowing. We want to know about non-motor symptoms. And then certainly we would love to have plenty of time to answer your questions and make sure we're addressing any concerns. So, to address the big elephant in the clinic room with you and your doctor, what is against us? Time. I think most of your doctors, most of us in this field would love to spend more time with our patients. We would love to have all the time that we need for each person that we see. But unfortunately, this is just not the reality of a very busy neurology clinic. And so, whether or not we like it or we're in control of it, your time is limited. And typically, depending on where you're getting care, a follow-up visit could be as short as 15 minutes or as long as half an hour. And that time can go fast. So we really, really want to make the most of it. For example, a 20-minute to 30-minute visit, here's an example of an agenda we need to get through. It's a lot of stuff. Medications, motor symptoms, falls, non-motor symptoms. We need to perform an exam. We need to answer your questions and concerns and then provide education or counseling. We then need to place orders in the system for new medications or referrals or tests. We then are also at the same time typing up this plan for you and trying to explain it so you really understand what the plan is moving forward. So it's a lot to get through. So the first thing you can do is make sure you have all that time. And if you budget extra travel time and arrive early to your appointment, you're going to ensure that. And just to kind of illustrate how tight things can kind of be, if you have an 8 o'clock visit, 8 in the morning, and you arrive at the desk to check in at 8 o'clock, you've potentially already cut your visit time in half. And the reason is before the doctor or any provider comes in the room, there are a lot of things that have to get done. So, for example, you need to find parking. You need to navigate your way into this giant complex. You need to wait in line for the elevator. You need to check in at the front desk. Then a medical assistant needs to come physically get you, weigh you, check vital signs, make sure your medications are in the system accurately. So you can see how that time can go quickly, real quickly. So if you arrive early, you are ensuring that you're going to have all the time you should have. Part of that is budgeting extra travel time for things we can't control, like terrible traffic, terrible weather, car accidents, parking situations. And I know that it can be very inconvenient to feel like you're wasting your time sitting in the waiting room. But again, this is just the best way to ensure that you've got the most time that you deserve. So with the time we have, how are we going to be productive and make the most of it? And being prepared is so critical. If you arrive to your visit kind of unprepared, not entirely sure about how I'm taking my meds, haven't really thought about my agenda in advance, haven't really thought about big picture trends in side effects and symptoms, you're creating kind of a recipe for an unproductive visit. So use notes. I don't necessarily always expect people to be able to quickly and accurately and concisely answer my questions. And so taking notes is a way that, again, you can ensure that you've kind of done everything you need to do to be prepared for your visit. And this is something I do with my daughter every time I go and see her pediatrician. I've got a set of notes, like what's on my agenda and what do I think is going to be on the doctor's agenda too. So what do we want to hear about? Well, we want to hear about your medications. And you may think that our medical systems, our medical records just magically know everything you're taking and how you're taking it. But certainly, if, as an example, you're getting care in different systems, they don't always talk. And so I would never assume that the system just knows what you're doing with your meds. So, really knowing what medications, what's the pill strength of each medication, how many tablets am I taking and at what times really helps me as the provider be able to help you more. So this is an example of a table that a lot of us will actually make and put in your note. And so what I'm talking about is understanding what medicine, so carbidopa, levodopa, and tacopone what pill strength. Well, the levodopa is 25/100 milligrams, and I'm taking 2 tablets at 8, noon, 4, and 8. And it'll become clear why this is so important to have a good understanding of. It's because how these medications and how we're taking them relate to your symptoms and side effects, which we'll get to in a second. But in brief, those Parkinson's motor symptoms I'm talking about are bradykinesia, or slow movement, rigidity, which is a particular type of muscle stiffness, sometimes a resting tremor, and sometimes walking problems like a shuffly, stumbling gait. Okay, AKA off symptoms. If it's not very clear when we talk colloquially about off symptoms, we're talking about this stuff, these symptoms as if you were off your medications. So if you're able to communicate accurately when certain off symptoms or side effects are occurring, that is just so helpful. So really, really look for patterns in this stuff. If you truly can't find patterns and this stuff is random and unpredictable, that's fine. But if you do pick up on patterns, it's incredibly helpful as the physician to hear things like, my 8 o'clock dose of levodopa never quite kicks in, versus I'm experiencing some wearing off 30 minutes before my 8 o'clock dose. That is very valuable information. On the flip side, too, we want to hear about side effects. As an example, dyskinesias, nausea, lightheadedness. And again, if you pick up on a pattern, like I'm having bothersome dyskinesias 30 minutes after my noontime dose, incredibly helpful. Because if it's not become obvious, if I get good information in, I give you good recommendations. We are sometimes only as good as the information you're feeding us. Okay. Next, we want to hear about falls and trouble swallowing. Why? Falls are dangerous and swallowing problems are dangerous. So we'd like to hear about it. And some specifics like, how frequently is this really happening? What do the falls actually look like? Like literally, how would you describe this fall? That helps me figure out the why. Are you falling because you have a weak foot and you're tripping? Are you falling because you're having freezing of gait issues? Are you falling because you're really lightheaded and you're near passing out? This really helps. Where do they occur? Are there like certain trouble spots or situations where you're more likely to fall or have a close call? Are you using an assistive device, a cane, a walker, something like that? Or do you have them and you're not using them? And are you already working with physical therapy or someone trained in the gait dysfunction in Parkinson's disease? Trouble swallowing. What's the trouble? Coughing, choking, trouble swallowing pills. What are you coughing or choking on? Nothing. Solids, liquids, both. And have you already seen and or follow with a swallow specialist? Next, we want to hear about non-motor symptoms, which are kind of what they sound like. They are the symptoms of Parkinson's disease that aren't wrapped up in those 4 main motor features: stiffness, slowness, shaky, etc. And this list is not exhaustive, but just to give you an idea of the types of things we'd like to hear about. Bowel or bladder issues, common. Thinking or memory concerns. And if you have them, can you give me specific examples of what you've been noticing changes in? Hallucinations, we'd like to hear about your mood. We'd like to hear about sleep, which impacts all of this stuff. and certainly issues with energy or excessive fatigue. Lastly, we need to have time to address stuff on your agenda, your questions, your concerns. And again, I would love to spend as much time as is necessary to address your 20 questions you came in with, but sometimes time is against us. So a really, really good tip is to rank your questions and concerns by priority. Think about like if there's only 3 things we can address today, what are they going to be? Okay. Lastly, try not to save an important piece of information or a question for the door, because once we're at the door, the visit's kind of wrapping up. Okay, so in review, what do we want to hear about? Your medications and specifics. We want to hear about motor symptoms and side effects, falls and trouble swallowing, non-motor symptoms that are bothering you. And we really want to hear about your questions and concerns. And that might sound like a lot, but this is just kind of a little example of a thing that I had once typed up for somebody. And all of this information is captured in this one piece of paper. And maybe this is something you might think about using or creating on your own. Some final pearls, or just kind of a summary. Make sure you have all the time that you deserve. So arrive early, budget in some extra travel time. I think that's kind of obvious. Think about some of the stuff in advance, prepare, and that's going to help this visit go more smoothly, be more productive, and use notes, because we all know what it's like. The moment the doctor sits down, sometimes we freeze up and kind of forget everything we were thinking about. Okay, know how and when you're taking your meds. Think big picture and look for patterns in bothersome symptoms, side effects, etc. And then lastly, really, really critically, if I'm explaining our final plan of the day and there's a detail that you're not really clear on, something you're not understanding, something wasn't communicated properly, you've got to let us know. You've got to let us know, because that just means we're doing something wrong. That's not a you problem, that's an us problem. And we could just maybe explain something a little bit differently. Okay. So again, thank you all so much for your time on the Saturday and braving the weather. And I'm happy to take any questions you might have.